A warm welcome to today's talk. It's Wednesday the 22nd of December. Now we have got some news from a few places today, but I want to focus on Australia because they are taking a radically different path, it appears to me. I'm going to give you the evidence and you decide for yourself. So we're going to be looking at that in just about a minute's time. Now, just before we get there, the United States is going to deliver 500 million home testing kits. So that's good development there in the United States. Now, there's 1,000 military helping out in hospitals across the country as well as National Guard units being deployed because, like the UK, there's just so many people off sick they're having to isolate because they're positive contacts. So that's happening, and the Omicron virus spread more rapidly than anyone thought, according to the President of the United States, who seems to have been caught somewhat off guard, it would appear. Now, this is not a political point, I stress, but the President of the United States should be advised by the best scientists and doctors in the world. Therefore, why was it such a surprise? Because you and me reasoned it out on this channel about a month ago now, but it appears the President was not informed, so questions perhaps to be asked there about the presidential advisors. As I say, not a political point at all. The Omicron virus spread more rapidly than anyone thought. Well, it didn't. It's spreading at the rate we thought it did. If anything, I thought it might be a week or so later in the States, but we weren't far out. It was fairly obvious as soon as we learnt the transmission characteristics of the virus. Just before we go on to Australia, there's been one Omicron death that we know of in the United States. A man in his 50s sadly died, did have underlying health conditions, was unvaccinated. So several factors going against him there. But that is one death, of course, in the context of the entire nation. Now, I want to introduce the Australia bit just with a short clip from Scott Morrison. It's only about a minute, and then we'll look on, because there's actually so much that he's saying in this clip. He's saying so much. So let's go straight on to Scott Morrison just for a minute now. If we can play that.
Yes, we're going to need to continue to calibrate how we manage this virus and how we live with this virus in the face of Omicron. Of course that is necessary, but we're not going back to lockdowns. We're not going back to shutting down people's lives. We're going forward to live with this virus with common sense and responsibility. And there will be other variants beyond Omicron. And we have to ensure, as a country and as leaders around the country, we are putting in place measures that Australians can live with. And what that means is we have to move from a culture of mandates to a culture of responsibility. That's how we live with this virus into the future. We've got to get past the heavy hand of government, and we've got to treat Australians like adults. And we all have our own responsibility in our communities and for our own health. People should get vaccinated. If you don't get vaccinated, you're more likely to get the virus, get very serious illness from the virus, and to die from the virus.
Even better if you can hear me. Scott Morrison there saying that we have to learn to live with this virus. So this is quite a radical change, I believe, in the Australian position. Now let's go on and look at that in a little further, because this could well be a model for how the rest of the world needs to go. So let's just start off with that now. So Australia, New South Wales, a lot of cases, mostly Omicron. Victoria, still quite a few Delta cases there, but Omicron will become more prolific there. So basically we'll see Omicron is in Australia, and as we'll see shortly on some graphics, we get the right one. As we'll see shortly on some graphics, it's increasing there quite dramatically. So the Australian thinking seems to be, is it possible to stop Omicron with vaccination? At least this is my interpretation of the Australian thinking. Well, we'd need near 100% efficacy, and of course we've got nothing like that. We'd need near 100% uptake, and of course we've got nothing like that. And we would need no waning of the vaccine, and of course we have got significant waning of the vaccine. So on its own, the vaccine is not going to stop this pandemic. We are not going to vaccinate our way out of this pandemic. It is that simple. And especially as Mr. Morrison said there, new variants are going to come along after this one. Not we might get a new variant, you're definitely going to get new variants. So natural infection promotes antibody immunoglobulin type A. Now, if you get exposed to, for example, a common cold virus, so you get exposed to a common cold virus, then that's going to go into your nose and your trachea and everything, into your mucosa. And specialised cells that are related to your mucosa, they put these immunoglobulin type A's into the mucus. So when you come across a virus and you inhale it, before it even gets down into the airways, there's immunoglobulin type A's that are combating that virus, that antigen, in the very airways itself. So that is one thing. You don't get that with vaccine. You get that with natural infection. So vaccine generates, natural infection generates IgAs, which are good because they're going to stop us getting symptomatic disease, because they're going to stop the virus literally in its tracks in the airway. This is what you get with natural infection. Vaccines generate immunoglobulin M's and then immunoglobulin G's, which of course are wonderful, but you don't get these ones in the initial protecting of the airway. Preventing viral replication in the upper airway. So immunoglobulin A can prevent viral replication in the upper airways. So it looks like Australia is looking at the natural vaccine as being superior, the natural infection rather, as being superior to the artificial vaccines in some ways. Scott Morrison there was stressed to say he wasn't being that is not an anti-vax message from Scott Morrison, and this is not an anti-vax video. Please don't think that. I've had 3 doses of vaccine myself, but it is saying it won't stop it on its own. This is simple science, and we simply have to recognise it. Science is the nature of reality. We have to recognise this. Allowing Omicron infection up to the point where hospitalisations are manageable. So it looks like they're going to be a permissive spreading of the variant in Australia. They're going to allow it to spread to generate the herd immunity up to the point where there's going to be too many hospitalisations. And if there is too many hospitalisations, if the hospitalisations are going up, then they can titrate up the restrictions that are going to be required to prevent that. But as of now, that is not happening. And again, more data on that shortly. So is that what they're going to be doing in Australia? Allow infections up, so this is permissive infection. Now, this is a recognised concept in healthcare, permissive this and permissive that. So, for example, I used to work with traumatised patients sometimes, and they'd come in with a low blood pressure, and we would allow that low, if the blood pressure wasn't too low, we would allow that blood pressure to remain low. We'd call it permissive hypotension, permissive low blood pressure. Because if we bumped the blood pressure back up to normal, then that could blow off the blood clots. So until the patient was ready for it, we permitted a lower blood pressure than you would want. So until the whole community is ready for it, maybe Australia's going to permit a certain amount of infection, knowing that will generate immunoglobulin A's, immunoglobulin M's and immunoglobulin G's. You're going to get the whole thing. So that seems to be the thinking. Now, if Mr. Morrison wants to come on and correct me, of course he can, but this seems to be the thinking. Less pathogenic with shorter hospital stays. So the Omicron is less pathogenic, shorter hospital stays, we believe. The shorter hospital stays is being debated. The South Africa data is showing that the hospital stays are shorter, about 2.3 days on average in South Africa. Data from the UK, which is incomplete at the moment, shows that if you are hospitalised with Omicron, then you're just as likely to stay in hospital just as long as you would have done with Delta. But as we say, that's incomplete. We don't know that yet. But we may well get shorter hospital stays, seems to be the Australian thinking. Natural immunity gives cross immunity to the next variant. So when you're infected with Omicron, then it may well be that you've still got some protection against Omega, because there's this cross, some resistance against Omega or whatever the next one is. That there's this cross immunity. Because the viruses are similar, you're going to get immunity going from one to the other. Having said that, the Omicron is so different from the Delta, we don't get a lot of immunity from the Delta from the Omicron. But it's likely that you're going to get some cross immunity. We normally do get a degree of cross immunity. A concurrent booster program for the elderly and people with other illnesses is ongoing in Australia, so that's another factor. Over time, the need for pharmaceutical and non-pharmaceutical interventions will diminish, seems to be their thinking. If hospitalisations do rise, population will self-titrate. So in other words, what we mean here is that if the cases do go up and hospitalisations do go up, that will increase anxiety in the population in general, and people will take more precautions. So that should start bringing rates down again. Now, let's give some more evidence for this. This is the Doherty Institute in, well, it's a combination between it's these two Melbourne institutions, Melbourne University and Melbourne Hospital. Now, this seems to be the equivalent of Neil Ferguson and his group in Australia, if I can be as disrespectful as that. Let's just say Neil Ferguson's predictions have not always, his modelling has not been always 100% accurate. And it seems that these modellers may not be 100% accurate as well, as we'll go on qualify. So they're saying that this Doherty modelling group is saying there could be millions of COVID cases by the end of January or early February. It's going to go rampant in Australia. There could be 200,000 infections per day in Australia, and that could result in 4,000, an unmanageable 4,000 hospitalisations a day in Australia, is what this Doherty Institute has modelled as a possibility. So Prime Minister Mr Morrison, as we've just seen, has commented on this. He says this: the modelling assumed that Omicron strain is as serious as the Delta, and in the light of the strain itself and the level of immunity we have, that doesn't seem to be the case. When it's in immune populations, it seems to be causing less severe disease. He says the modellers failed to account for boosters, which of course are a big factor, or people taking sensible behavioural responses in what they're doing. Australians are adults, as Mr Morrison said. So I wouldn't want to alarm the people over that report, Mr Morrison says. That is not what we are actually expecting to happen, Mr Morrison says. The grim predictions are highly unlikely. So isn't it great to see a politician who's actually saying to these modellers, just a minute, mate? And that's probably exactly what he'd say. Just a minute, mate. Hang on about it. Just a minute. Just a minute. Just because you're a modeller. Mr Morrison says that there's a range of scenarios, which of course there is. Of course, the number of Omicron cases will increase. Of course, it's highly infectious, he says. But then Mr Morrison goes on to say, but the indications are that it's not as severe, and our hospitals in New South Wales and Victoria have been coping extremely well. And of course, Omicron has been in Australia for longer than we has been officially recognised. Now, is this just the Premier going off on a frolic of his own, or is this consistent with what medical opinion in Australia? Well, this is Professor Paul Kelly, Australian Chief Medical Officer. He's talking about this report. He said selective and misleading media reports about ongoing modelling, that the predicted hospitalisations the predicted hospitalisation estimations are unlikely, he says. They are unlikely. Evidence about the characteristics of Omicron is still emerging, but the early trends seen both internationally and within Australia suggest that it is more transmissible. Well, yeah, that's certainly the case, which of course is good. So what's that Latin phrase? Is it carpe diem, seize the day? Has Professor Paul Kelly seized the opportunity of Omicron? Interesting. Don't want to put words in his mouth, so let's go on to direct quotes. However, early indications around hospitalisations, intensive care unit admissions and deaths show that Omicron could be far less than Delta with other variants. It's hard to read these things when I'm online. But basically what he's saying is that the Delta is not as severe. Sorry, the Delta is severe, the previous variants were severe, the Omicron is not as severe. That is what he was saying. Importantly, after almost 4 weeks in Australia, so longer than we'd thought, after almost 4 weeks in Australia, of Omicron in Australia, there are currently no confirmed Omicron cases in ICU and no deaths confirmed to date. Now, okay, it's still early, but this is the Chief Medical Officer. Good to see a Chief Medical Officer forming his own opinions, using his medical judgment. Modelling is one of a range of tools and it can't be viewed in isolation, so I guess in English would say take it with a pinch of salt. A preliminary scenario of many being considered to help inform decision making. So the modelling is not saying it's rubbish, but it's saying it's just one tool that we can use. He does say it presents one of the worst case of all potential scenarios, including assumptions that the Omicron variant is as severe as the Delta variant, which we don't think it is, in fact, in vaccinated immune populations. An absence of hospital surge capacity, which, of course, the Australians are well capable of providing. A highly limited booster programme, which is not the case. The Australians are running a comprehensive booster programme. And he's saying the model also assumes no change to baseline public health and social measures, which, of course, there would be. The public aren't stupid. They would titrate up their measures if needed. And an absence of spontaneous behaviour change in the face of seriously rising numbers or case numbers. And of course, people would change their behaviour. So there you go, casting question marks over some of the implications of the modellers. None of these 5 assumptions represent the likely state of events, let alone all of them happening together. So, in fact, we know all 5 aren't happening together because we know the booster programme's good, for example. We know the hospital capacity could be increased if it needed to be. Therefore, presenting that scenario as the likely scenario that will occur is highly misleading. So good to see he's making his own mind up. Is he the only senior medical person in Australia thinking this? Well, the former Deputy Chief Health Officer, Nick Coatsworth, whoever leaked the Doherty model without context has committed a gross injustice to the Australian people. Federal Health Minister Greg Hunt, despite the rapid spread of Omicron, only a fraction of cases were ending up in hospitals. So there you go. It looks like Australia is adopting a policy of permissive herd immunity, titrating it as it goes if necessary. Radical change. Let's call that the Australian Protocol. I think that might be a good name for that. We'll call that the Australian Protocol. Now let's just go and look at some of the data that we're keeping an eye on from around the world now. Now these are this is the one we've been keeping an eye on. This is just I just downloaded it immediately before we do the video. Currently in hospital in the UK about 7,800. In South Africa, similar population, 9,300 people in hospital. So relatively small numbers of people in hospital after 4 weeks of Omicron in South Africa. 1,329 people requiring oxygen in all of South Africa, 239 ventilated. And as we know, about half of the cases that are Omicron positive in hospital in South Africa, they were found to be positive when they were admitted to hospital for some other reason. So we are not seeing a disastrous hospital situation in South Africa 4 weeks in, and by now we really should be. Now, of course, I know it could be another week or another week. I know there could be a delayed time gap between the first symptoms and the severe onset of complications with Omicron. It could be different, but it's 4 weeks on now and we're not seeing it. In South Africa, we are simply not seeing it. Good news. These were London admissions, hospitals in London. There was 245 admissions, up from about 201 the day before. Now, so far, we believe about 40% of these are incidental findings. So I guess we could knock about 80, well, we could knock quite a few off that because about 100 off that because 40% are incidental findings. So yes, admissions are up, but not all of the admissions are there because of Omicron. And of course, we get more hospital admissions at this time of year anyway. And of course, when people go into hospital, everyone, of course, is tested. So obviously, you're going to pick up a few cases. But it's not, not the prime reason for their admissions. COVID patients actually in hospitals in London, 1,904. It depends how long patients stay in hospitals, but 400 will be the critical point there that London hospitals would really start struggling. But of course they are struggling already because so many staff are isolating. So this is new confirmed cases per million. Let's look at this data. Now Japan still doesn't seem to have any. Australia going up because of Omicron, of course, as we know, particularly in the New South Wales area, Sydney area. Canada going up, United States, Omicron surges beginning, France, Ireland, United Kingdom, Denmark. Now, Denmark appears probably higher than it actually is because Denmark is picking up more of infections as cases. So it's actually picking up more because of their testing is so good. But at the moment in Denmark, they've actually reached the capacity of their PCR Not the PCR ability. They can do PCRs. They've reached the limit of their ability to do genomic surveillance, because Denmark was doing more than anyone else in the world, but they've now reached their capacity on that. So what they're doing now is storing all samples for future analysis. But part of that reason is that Denmark are remarkably good at testing. Let's go on and look at some more data. Number of patients in hospital per million. So we see Denmark is going up a little bit, but not that much. So it looks like this is what the hospitalisation surge. So it could be that is what the surge in cases with Omicron looks like in the Danish situation. It could be that's what the increase in hospitalisations looks like. France hospitalisations are high due to Delta cases. The United States, it's still Delta cases that are causing that. The United Kingdom, as we've seen, it's mostly Delta. Ireland, it's mostly Delta. Denmark, Omicron is more there. Canada, hospitalisations are going downish. Now, I don't know what's driving them in Canada at the moment. If you're from Canada, do update me. New daily confirmed COVID-19 deaths per million. Well, the United States has remained high, but again, that's because of Delta. France, Denmark, United Kingdom, Ireland, Canada, Australia, Japan in terms of confirmed deaths. New daily confirmed COVID-19 cases per million. United Kingdom still shooting up. South Africa still starting to go down. Now, these differences this looks like the UK has got way more than South Africa, but of course the testing is much greater in the United Kingdom than in South Africa. So the overall numbers of infections are probably, well, they are much more comparable. I mean, basically Omicron has spread through all of South Africa in the last few weeks. So the actual number of infections are way, way higher than this. But if we assume that the number of cases are picking up a consistent percentage of the infections, then we do indeed see that things in South Africa do seem to be starting to go down. And it's looking like it's going to be narrow compared to, for example, the Delta time duration. United Kingdom still going up. United Kingdom will probably go up for another week or two. Cases could well peak in about the first, probably no later than the second week in January in the UK in terms of cases. That is being the number of infections that are diagnosed. Deaths, United Kingdom, South Africa. So yes, the deaths are up a little bit in South Africa, but considering Omicron has affected probably, well, who knows, 50% of the population of the country, it's not a huge increase in deaths, thankfully. So there we are, some pretty interesting data there. Links wise, all the links are in the description. South Africa, UK data. Now I think let's just have a look at the UK situation now. So this is where we get the hospitalisations from in the UK. It's this government site here. And unfortunately, they haven't updated the information yet. This is still the information for the 21st of December. But if you go onto that and look at it, then we see that the number of patients in England who've been diagnosed with Omicron is 129. And we see there's been 14 deaths related to Omicron. Whether it's with or from, we don't know. So that's the one we're keeping an eye on to work out what is going on. And so far, it is not a big problem so far. Let's just look at the numbers in the UK. So, up an awful lot on the week, 63% on the week. But if we look at let's look at cases as well. So, as we see, cases, yeah, this is what I expected. This has just been updated. So that should be the data for the 22nd there, I think, if I can get my cursor on it. Yeah, 22nd. Actually, that's not bad. Just over 100,000 cases. We knew it was going to be higher because the last couple of days have been the weekend, and the day, the cases always don't get through as much at the weekend. So 106,000 new cases confirmed today. The real number of infections, perhaps 3, 4, 5 times that. So if we assume the real number of infections is 4 times that, we're looking at 400,000 cases a day. 5 times that, 500,000 new cases a day. Roughly where we'd expected it to go, to be quite honest. We did predict this quite a few weeks ago, roughly where we thought we would be. Just check healthcare overall in the UK. Patients in hospital, as we said, flattish at about 7,500, just over, I think. Oh no, actually 8,000, just over 8,000 there, the latest data for the 21st. So slight increase, there is a slight increase. Patients in hospital, patients on mechanical ventilation, thankfully not going up. Okay, so healthcare looking flattish in the UK so far, despite the huge increase in cases. Now I'm just going to do a very quick last couple of minutes here. Self-isolation in the United Kingdom. People infected with COVID-19 in England can stop self-isolating if they get negative lateral flow tests on day 6 and day 7. Got to be both. After that, it's strongly advised to limit contacts with vulnerable people, crowded areas, poorly ventilated spaces. But the point is they can leave at 7 days, not 10. So it's 7 days now. They can leave if they get 2 negative tests, not 10 days. Because we're running out of workers. So this is the pragmatic way forward. I mean, this is Sajid Javid acting on expert advice. So that's good. Applies to everyone regardless of vaccination status. They can leave at 7 days. Symptomatic should, if people are symptomatic, they should carry on self-isolating. And people not double jabbed who have close contact with a positive case must still isolate for a full 10 days. So what it's basically saying is the lateral flow tests, most of the lateral flow tests are going to be negative after that time. And the idea was the lateral flow test is it's not as accurate, of course, as the PCR test. Of course not. But it's the idea is it's going to be positive. That was one I did a couple of days ago because I've had a bit of a cold. So you can see it's why is it back to front? Oh, there we go. Anyway, it was negative. But the idea with these tests is that they'll show positive if there is enough virus present to cause infection. So they are pragmatic tests, not absolutely diagnostic like PCR. So that is the change in the UK, a pragmatic shift. So Australia, I hope I haven't got that completely wrong, but it does seem they are taking a radically different philosophical approach. It does seem that the modelers have been contextualised in Australia, and the senior medical officer and the Prime Minister have got the courage of their convictions to take forward what they believe to be true, and for what it's worth, I think they're probably accurately interpreting the data that we have available. Thank you for watching.